Hello, my name is Benign from Korea University Medical Center in South Korea. We are very pleased to present this study at the ICS. I have no potential conflict of interest to report. Given the previous studies have demonstrated upon other receptors present in the brain, there is a potential risk of adverse effect with regard to cognitive function. In particular, a recent big population study demonstrated the use of tamsulosin increased the risk of dementia in BPH patients. However, a recent study that presents tamsulosin is associated with dementia has short follow-up period. We investigated whether the use of alpha blockers containing tamsulosin was associated with the risk of dementia using National Health Insurance Service database of Korea. Total 256,000 population were diagnosed BPH in 2011. We excluded patients who had prior cognitive dysfunction and dementia. In addition, patients who had a history of chemotherapy, chronic use of anticholinergics, antihistamine, and receiving other type of BPH medication, and patients who switched to an alpha blocker acting on a different receptor type also excluded. Total 59,263 patients were enrolled to our study. We constructed tamsulosin comparison cohort and no BPH medication comparison cohort. After propensity score matching, no significant difference exists among the measured baseline covariates in the propensity score matched cohort. Kaplan-Meier analysis indicate that those receiving tamsulosin had a higher cumulative probability of remaining dementia-free than those who receiving trazodone in propensity score matched cohort. However, there was no significant difference in the cumulative probability of remaining dementia-free among those who received tamsulosin in comparison to those who received doxorubicin or amphotericin. In no medication comparison cohort, BPH medication any time had a higher cumulative probability of remaining dementia-free. In multivariate analysis compared to the tamsulosin cohort, the trazodone cohort was more highly correlated with the risk of dementia. However, the doxorubicin and amphotericin cohort were not correlated with the risk of dementia compared to the tamsulosin cohort. However, compared to non-medication cohort, the BPH medication cohorts were associated with a significantly decreased risk of dementia. Within the tamsulosin, doxorubicin, trazodone, and amphotericin cohort, and using the low dose level as a reference, higher dose levels were associated with decreased risk of dementia. In the multivariate analysis between the tamsulosin and other medication cohort, the risk of dementia did not significantly differ at the reference and low dose levels. The findings of this large population-based study indicate that the use of BPH medication is not associated with an increased risk of dementia by duration of use or by medication type. Further well-designed prospective studies are warranted to validate our findings. Finally, this study is accepted in the journal Urology. Thank you.